Okay, today I'm going to be role-playing a difficult conversation with a 16-year-old patient who just learned she's pregnant. This conversation is challenging because it involves discussing an unexpected pregnancy, confidentiality, emotions, family relationships, and spiritual beliefs. My goal is to communicate compassionately, respect the patient's autonomy, assess her spiritual needs using the FICA tool, and provide safe evidence-based care even if she declines the treatment. Hello, Emily. My name's Jessica. I'm a nurse practitioner who's going to be working with you today and going over your test results, okay? How are you feeling?
Nervous.
That's understandable. Waiting for test results can usually be pretty stressful. I do have your pregnancy test results, and they did come back positive. You are pregnant.
No, I can't be. I can't tell my parents.
I know this is overwhelming for you, and I'm very glad that you're here talking about this with me instead of facing it alone. Can you tell me what's going on through your mind right now?
They'll kick me out. My dad would never forgive me. My mom always told me if I got pregnant, my life would be over. I'm not telling them.
I know that's got to be challenging. Thank you for trusting me with that. It sounds like you're scared not only about the pregnancy, but how your family might react. Those are very real fears. Everything we discuss today is confidential in most situations. The only exceptions is if I'm concerned someone is hurting you, you're being forced into something, or you're in immediate danger. My priority is making sure you're safe and you feel supported.
Thank you.
Normally, I recommend starting a prenatal vitamin with folic acid, obtaining blood work. I want to check your overall health and blood type. I want to schedule an ultrasound to determine how far along the pregnancy is and arranging prenatal care as soon as possible. I'd also like to discuss avoiding alcohol, tobacco, vaping, recreational drugs, and medications that could harm your pregnancy. I'd strongly encourage involving a trusted adult because this is going to be very difficult to go through alone.
I don't want any of that. I don't want blood work. I don't want an ultrasound. I don't even know if I want to keep the pregnancy. I just want to leave.
Thank you for being honest with me. You don't have to decide today whether you'll continue the pregnancy, and I'm not here to pressure you. My responsibility is to make sure you understand all of your options and you stay medically safe.
I don't want to go to any appointments.
And I respect that decision. Can I ask you what worries you the most about coming back?
If anyone calls my house, my parents will find out.
That's understandable. We can discuss ways to protect your privacy while still making sure you have access to healthcare. If you change your mind later, we'll be here for you. Would it be okay if I asked you a few questions about your spiritual beliefs? Sometimes they can be pretty important, especially when in need of a source of support.
Okay.
So first we're going to discuss about your faith. Would you say faith or spirituality plays a role in your life?
Yes, my faith is very important to me. My family's Christian. We go to church every Sunday.
Can you tell me what your faith means to you?
I always believe God loves people, but now I feel like I messed everything up.
How are your beliefs affecting the way you're thinking about this pregnancy?
I feel guilty. I feel like God is disappointed in me.
Those sound like very heavy feelings for you to carry. Has your faith helped you through these difficult times before?
Usually, but right now I just feel ashamed.
Thank you for trusting me with that information. Do you have anybody in your faith community who makes you feel safe or supported?
My youth pastor, but I'm really embarrassed to tell him.
Sometimes the people we expect to judge us the most are actually our greatest source of support. I think you should think about talking to your youth pastor more.
I'll try that.
As your healthcare provider, how can I respect your spiritual beliefs while caring for you?
I don't know. Maybe I just wish someone would pray for me.
Thank you for sharing that. If praying together would bring you comfort, I'd be honored to pray with you. And if you ever want help connecting with someone from your faith community, I can also help arrange that.
Do you think I'm a horrible person?
No, not at all. You're a 16-year-old female who just received life-changing news. My job is not to judge you. My job is to care for you, answer your questions honestly, and help you stay safe. Even though you've decided not to begin prenatal care today or set up future appointments, I'd still like you to leave with information about pregnancy, warning signs like heavy bleeding, severe abdominal pain, and when to seek immediate medical care. I also recommend starting the prenatal vitamins if you're willing, and I'd like to schedule a follow-up appointment in 1 week. You can change your mind about any of today's decisions at any time.
I think I'd come back next week.
Okay, thank you. We don't have everything figured out today. We'll take one step at a time, and we'll see how you're feeling at next week's appointment.
Thank you, ma'am.
You're welcome. This scenario demonstrates patient-centered communication while respecting adolescent confidentiality. Although the patient repeatedly declined recommended treatment and refused prenatal care today, the provider respected her autonomy, ensured informed refusal, completed a thorough FICA spiritual assessment, offered compassionate spiritual care, and created a safety-focused follow-up plan that maintained the therapeutic relationship.